Let me very briefly, and I don't have a lot of time, ask the panelists, very briefly, yes, no. Should the United States, in fact, join every other major country on earth, guarantee health care to all people as a human right? Mr. White?
I think the experience we've seen in every other country is that it doesn't work well.
Doesn't work well, huh? Ms. Strauss?
I would say, looking at the way the ACA has worked for us, absolutely not. This is the
Okay.
first indication that it will not work in the
Dr.
United States.
Fegan, you've studied other countries around the world. Mr. White says they don't work all over the world. Countries want to join the United States, see a doubling of their health care costs, and deny millions of their people without health care. Is that what the trend
You
is?
should ask the
Okay,
people with
Dr.
the
Fegan,
conditions in those countries
Ms.
how they get
Strauss, you
treated.
had your time. Dr. Fegan?
Yeah, every other country has managed to cover over 99% of their population, and their life expectancy is longer than ours, and they spend half as much as we do. We absolutely should do it.
Dr. Fegan, the Nonpartisan Congressional Budget Office has estimated, and this is really the important point. You want to talk about affordability? The CBO has estimated that Medicare for All would save the American people $650 billion a year. $650 billion. That's an enormous amount of money, and provide comprehensive health care to every man, woman, and child. That's not me. That's the CBO. When we talk about an expensive system, current system, we're talking about enormous amount of waste and bureaucracy in administering hundreds of separate plans. She has a $10,000 deductible. I have a $5,000 deductible. You have no health insurance. Dr. Fegan, based on your experience, what does that mean, the complexity of the plan and the cost of the plan and the impact on patients who walk into your office?
Patients can't figure out how to access the care they're entitled to, and as a result, they often don't get the care they need. We could save billions, as you indicated, hundreds of billions of dollars, and we know that over 50,000 people a year die as a result of not having health insurance.
As you well know, everybody here knows, the Trump's big, beautiful bill is going to throw approximately 15 million, more or less, people off of Medicaid. These are low-income and working-class people. And that decision was made in order to give $1 trillion in tax breaks to the top 1%, Mr. Musk, Mr. Bezos, and others. What happens when you throw 10, 15 million low-income and working-class people off of the health care, off of Medicaid health care they have now?
When we take away health insurance, people die. It's just that simple. People do not get preventive services. They do not get the basic problems that we know how to treat. Their diabetes becomes uncontrolled. Their hypertension results in increased strokes. We know that people have greater disabilities. We know that working class people will make decisions that will mean skipping their health care until they are desperate and come into the emergency department. And at the time that they present with their illnesses, we'll be forced to take care of them, and it will cost us more. It costs us more to take care of the stroke. It costs us more to put patients on dialysis. It costs us more when patients have diabetes and that's out of control, and then we have to amputate limbs. We know that eventually they'll come into the emergency department, and COBRA requires that we take care of them, regardless of the cost. And so we're costing ourselves more at the back end, and we're losing contributing members of society.
Which raises the question of why we spend approximately half as much per capita on primary health care, disease prevention, as other countries. If I'm an insurance company, do I want to really invest in keeping people healthy? Is that where I make my money?
The United States has about 0.3 primary care physicians per 1,000 patients in this, and every other country has over at least like 0.8 or 0.7 primary care physicians per 1,000. So we don't produce enough primary care physicians to take care of the population at this time.
And we underpay those physicians as well.
We do.
You say as a primary care physician, right?
As a primary care physician.
Just so everybody understands, you and I, a couple of years ago, were in Toronto, as I recall, right?
That's correct.
Okay. And the doctors there were telling us they do major surgery, good quality care. What's the bill when somebody comes out of a major procedure at a Canadian hospital? How much are they going medically bankrupt?
Absolutely nothing.
Nothing.
And matter of fact, we visited the billing
And how much
office.
do they spend per capita compared to us?
They spend half as much.
There you go. All right.
But
Maybe
they're
we
4
should
years
study.
longer.
Maybe we should study that.